So I'm here with the force of nature, that is Karen McDonnell. I am very, very, very fortunate to have known Karen for a very long time. And she's just one of those people that just encourages everybody. And I've always found her an incredible encourager. I was just saying to her before we went on air, what am I calling you? Because you're not really retired. I know your role was retired, but you're still doing so much. And we sort of came up with an advocate for the profession.
Yeah, that'll do.
So, yeah, Karen, tell us a little bit about your career, how you got, because I know you're on multiple committees, you were part of RoSPA for many years. Tell us a little bit about how you found your way in to health and safety.
So, not dissimilar to many people, it wasn't a first choice, but we're talking a considerable period of time ago. I worked for RoSPA for 35 years. So the route that I took was through higher education. So I am an applied microbiologist. So my background in biology is very strong. And then I wanted to go further in my education. So I got the opportunity to do a PhD. I've got the title beside me because it's a long time ago also. And it was the study of thermal environment in hotel kitchens, which is a topic that haunts everybody, external, internal temperatures, particularly now what we're experiencing, here in the UK. So as part of the study of the thermal environment in hotel kitchens, I was very much focused, very person-centred, so it was the impact on people of heat stress through exploring the fixed environment and how people, work rest schedule, that whole piece about fatigue, etc. And within the research was to look at health and safety legislation. So I would say there's always been a silver thread when I did my PhD and had to look at it in detail and think about what changes would you suggest you should make to legislation in order workers could be protected. So I did my PhD and then had to move into, my dad used to say, the real world. I think I've always lived in the real world, So and the opportunity to work with RoSPA here in Edinburgh, because I'm based in Scotland, came up, and I went to work with RoSPA and just loved genuinely every minute of it. So I moved from designing and developing training courses. So this is all health, safety, occupational health work threads all the way through. I was thinking about the importance of being at the table. So I think my career moved the way it moved because I understood that collaboration and communication and speaking the same language as other people was so fundamentally important. And I've had been said from very early stage about my ability to bring people round the table, and then sometimes you've got to build the table itself, so my first piece would be to ensure that you create a community around about you that you can approach to provide support, information and advice and share ideas. And through creating that table, you provide the opportunity for everybody to move forward. So being at the table or building the table in the first instance, I would say, was something I learned very early on in my working life. And then recognising that people don't always step forward to be part of things because they might feel that, well, what can I add? But I'm a great believer in finding the essence in people where, you find that spark that they want to engage and they want to make a difference and provide a conduit for that. So I think a lot of, again, the progress that I made and the progress that people made because we moved forward together was very much about creating those conditions for people to thrive. And those early connections I am still in contact with, so it's not about moving forward and moving on. I think it's about having a network of people who understand who you are and your experience, and then know that they can ask you for support and it won't be an afterthought. you know, that whole piece about moving forward together. I also place great store on being visible and connected. Some of the work I did in my latter years, working for RoSPA, was about, you know, community building around women in safety. I thought, well, what do we want? You know, we want
Yes. Yeah.
more people to be visible,
Yeah.
recognizable, whether it's in their own company, whether it's in their own geography, whether it's on a world stage, but to have the
Yeah.
connections that are there at each of those levels that can help them round out the messages that they've got, and develop as a consequence. Being visible and connected is something I think is really important.
That's really interesting, because when I picked out what was our strapline for women in health and safety, visibility and connections and learning were the three aspects. And one of the things that I find really interesting, Karen, and maybe you can comment on why you think this emerges, is that lots of women working in health and safety now, which has been fantastic to see the rise of that over the last 35 years since we first met, you know. But a lot of them are not that visible. And when I say not visible, I mean that they're not writing articles, speaking at conferences. We ran a session a week or so ago, and somebody had been asked to help organise a conference, and pretty much all the speakers were male. I wonder if there's something around not feeling that they have something to contribute. Or is it actually, as a woman, I feel that my value comes from my productivity, and that people should kind of know what I'm up to, and therefore I don't prioritize, you know, doing that whole speaker piece or the writing piece or sharing lessons. Any observations you've got on that, and why is it important as well to be visible?
I think it's fundamentally important for a whole array of different reasons. I think sometimes people don't step forward because they might not believe they'll get any value to add. However, I'm a great believer in just the essence that somebody brings to their role, the experience that they have, the ability to bring people together as teams and lead teams. You know, every leader has a story to tell. And I think that perhaps a softer approach to encouraging people to come forward and speak would work. I think there's quite often a bit of criticism about same speakers at different things, you know. So I think that it all perhaps also falls to organisers to think, you know, right, how do I find these, because they exist and there are thousands of people who've got.
It's
Yeah,
self-perpetuating. Someone's good, and so you think, oh, I need to have
yeah,
them because they're good. If you don't know somebody's good, it's really difficult to take a punt and go, well,
yeah.
let's have them. Because, I mean, I saw somebody the other day speak, and she was absolutely fantastic. She was working at a paper mill in Sittingbourne, and she did a speech about all the things she'd done in health and safety and about her team. And I was like, oh my goodness, you're amazing. But I wouldn't have known that if I hadn't actually seen her.
Both yourself and myself, you know, being immersed in mentoring people. And there's that time in the majority of mentoring relationships, you need to hand them over to somebody
Yeah.
else who's going to be their next step. And I almost feel that I think I can definitely say hand on heart, there's never been an approach I've made to somebody who, when they've said, I don't want to do that, they've said, oh,
Yeah.
well, I'm not really quite sure what will involve. Do you think we could have a three-way conversation to start with? You know, so maybe that mechanism, methodology to get people to become more visible would work, you know, whereby you explain that it is straightforward once you've got the understanding of what's needed, but making that approach from a position of understanding who's out there may be a better way to get more people to come forward to speak at conferences.
For you, from your perspective, is visibility important?
It works on so many different levels, really. I mean, in terms of professional development, continuous professional development, building your own self-esteem, rubbing out imposter syndrome, that whole piece is all about having confidence in your visibility. So, and it helps when people want to progress through their careers to be more visible within their own organisations, so that if, for example, there's somebody who's working very, very hard but just isn't quite as shiny as somebody else, for want of a better
Yeah. Yeah.
explanation, somebody who's more visible because they're just better at explaining their ideas. So I think that there's an opportunity there for people to build their network, and then the visibility piece helps them elevate. And again, I can only speak really from my own experience, whereby we gain the confidence to pick up the phone and literally speak to
Yeah.
people around the world and say, I know somebody who is experiencing this issue, or I know somebody who speaks on this phenomenal topic and it's a topic that needs to be more visible. They would welcome the visibility and just become more connected as we move forward. So you move away
Yeah.
from the same.
I can see some of the ingredients that have made you successful, but what have been your biggest challenges, would you say, in across your career?
I think if I take a step right back in time, walking into a room to like a professional development conference and being literally the only female. And then you've really got to employ the ouch model. You've really got
What's
to
the
own
ouch
it.
model?
Own it, understand it, control it, and treat it holistically. So you've totally just got to own your space. And I was kind of reflecting 10 years in to owning my space, which I did well, but not without being anxious about it, because you do. I mean, I'm very much what you see is what you get. So, but you might not see everything. I'm getting an hour to make myself visible and get what I need for a project. 10 years in to my career, I was wandering, walking along a corridor with a very good friend. So there was no ill intention here, and 10 years in, and he said to me, he said, well, Car, how long have you been doing this for now? And I said, 10 years. And he said, you know what? I think you might make it. And I said, thanks very much. I fully intend to. I mean, overcome like barriers. I was incredibly fortunate working with the organisation I worked with, who were open to new ideas.
Mm.
So doing funded projects for government where you had to come up with new grant programs and innovative ways of thinking. So in terms of barriers, I genuinely didn't have some of the issues that others may have encountered in their working
Yeah.
lives.
Yeah.
I think that probably for me, I've got a very good friend that I've known for 25 years. We didn't know we had the same birthday because you tend not to talk about. Historically,
Yeah.
you didn't talk about anything like that. You didn't
Right.
talk about anything to do with your out of work life. I have two children, 33 and 31. I hope I've got that right. But that whole thing, because you just went back to work and
Yeah.
that was
Yeah.
it. And there was that for women in my age, that was exactly what was
Yeah.
expected. So,
Yeah.
and it all worked very beautifully, but those challenges are there. So within a workplace context, nothing particular that immediately springs to mind, but that being a whole person with a whole life and
Yeah.
going to work as well
Yes.
is a
Yes.
challenge, irrespective of who you are, but
Yes,
that's the whole
and
piece.
possibly a challenge which impacts women more than men, apart from maybe being the only woman in the room sometimes, and then also having the whole life going on around you. Do you think it's made it easier for you in some ways, being female in the space that you've been in?
I think that to progress, when you take the first step towards progression, it's easier. So and I was Irish president, I think it was in 2017. So very familiar with being in a room where, you have to provide convincing arguments based on fact why you should progress, and that whole piece. So I think when I took that step in particular, you took the step from UK into a much broader global environment, which stood everybody connected, whether personal or work related. That visibility was enhanced quite dramatically, which worked for me because I could talk about the things that I was doing within a workplace context to a much bigger audience, and convince more people to move down those particular roads, like the whole person, whole life approach to accident prevention, for example, or the management of occupational road risk, things that I was immersed in
Yes.
when I was in work, and the women in safety piece,
Yes.
which
Yeah.
has definitely been a golden thread, not a silver thread, that
No.
whole piece,
Yeah. Yeah.
about
Yeah.
ensuring that, because the experience you have going through the career that I've had to date, you can have an informed conversation with people who want to move forward but are trying to overcome barriers. So you can reduce the impact of those barriers being in place, because you use your experience of, how can you work this situation round.
One of the things I think is really interesting about the two of you is that we all lived through the Margaret Thatcher era and the kind of 1980s successful career woman. And that was supposed to be a woman that behaved like a man, wasn't it?
Yeah.
And that has not been either of your modus operandi at all, has it?
Not at all. When my parents encouraged my sister and I to leave nobody behind, just to make sure that if the people round about you move forward with you, whatever moving forward looked like, at that particular point in time. And I've had someone say to me about, about being really diligent and getting back to everybody who got in touch with me. But I'm thinking, well, I still get lots of different connections in touch on a daily basis. And so my understanding of how things work and where that tiny little readjustment to connection could be made,
Yeah.
so other people can have value added to their working lives. That's pretty much how I think about what I do. And let's face it, you can't take any of it with you when you go. I'm trying to think. I used to have a quotation I used, and it was about a weaving the threads. Leadership wasn't a weaving, it was a weaving of threads. So it's not training, it's bringing all these things together and having a consistency within the sector that says, I know how this can be resolved, and I'm happy to speak to you about it, and I'm happy to make the connection, and then step back and allow those
Yeah.
connections to flourish.
Yeah.
And I think that's really important, and particularly for women, and international people are working in an international context, because obviously I'm based here in Scotland, and UK on my doorstep. That whole piece about people working internationally that need to understand more about how things are done in the UK, making those connections is, with the longevity in the industry, is something that is a privilege to do for people. So yeah, fundamentally important to keep sharing.
And obviously, when we first started, the profession had a fairly narrow demographic, didn't it? And
Yeah.
we've been fortunate to see that there's, it's flourished in terms of ages now. There's a lot of younger people, and there's a lot more women. We are underrepresented in certain demographics still, that's for sure. But why is it important that we encourage diversity in the profession?
We need to be able to look at issues holistically.
Yeah.
And person-centered approaches have to include people,
Everybody.
and understand how it
Yeah.
works and how it can impact, being able to identify how it impacts on people and then provide whatever support's needed. We need to have more than one perspective. We need
Yeah.
multi-perspectives in order to understand what the issues are within the workplace. I mean, I volunteer with an ADHD plus charity, so neurodivergence, and how do we ensure that everybody understands the information they need to be successful in the workplace? How do we ensure that everybody can interpret that, has got the same access to it,
Yeah. Yeah.
has the right level of support in the environment that they work in? So there is a real need to keep fine tuning person centered approaches, I believe.
Yeah. And one of my questions is around what you're most proud of. But I guess also, what legacy would you like to leave?
Legacy. I get an absolute buzz out of seeing people progress. Full stop. So there is nothing I enjoy more than reading an article by somebody who had never written an article before, hearing a review of somebody who'd never spoken at a conference before, finding out about a successful workshop, or getting a grant program accepted by a government, that whole piece. So, and I'm fortunate to see that in the network that I have round about me. And I think that people that I've worked and or volunteered alongside, if they just took that moment to recollect that simple conversation about something that made a difference to them, and just kept nurturing people round about them, because that is how it works. It should just be as natural as possible to want other people to succeed.
Yeah. 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 And I guess that there's a journey that we all have to go on, isn't there? Once we understand that we have value ourselves,
Yeah,
it's much easier then to bring on everybody else around you. Otherwise, we're spending all of our time proving ourselves, aren't we?
that's right. Yeah. And to be a champion for other people. That's what I
Yeah.
would like. I would like, and I do see it with people
Yeah.
that are in my network. They champion others.
Yeah. Yeah.
So that's what I would think, from a personal perspective, would be really useful. From a profession perspective, I think that it's really important we keep focusing on evidence base
Okay.
for the work
Yeah.
that's done, the work that the people that will listen to this are doing. What's the evidence base for the activity and what difference is it making?
Do you feel concerned that we're not always doing that at the moment?
We do lots of things, but to actually look at the actual evidence base for the change that's been put in place and how well it's worked, I think there could be a deeper understanding of that. And I can't let this go without mentioning Sheila Pantry, who,
Oh,
if
Sheila
Sheila Pantry
Pantry.
was sitting with us today, she would say, where are they getting their information from?
Oh,
And how do they
yes.
know it's real
Yeah,
information? So I think there's a
she
whole
would.
piece about where are the people listening to this podcast getting their information from, how are they using it, and how are they using it to build an evidence base for what works that protects our people.
Well, and that very much reflects a conversation that I was having last week about AI. And I know you're now getting very involved in AI, aren't you? In
Yeah.
terms of, is it always accurate? No, it's not always accurate, is it?
Yeah, it's very important, fundamentally important. So her legacy sits with both of us and others, you know. So I would hope
Yes.
that others take the sort of essence of weaving threads together when they think about what they could do differently. Weave those threads, get the rich pattern, and help everybody move forward.
For anybody listening to this who wasn't fortunate enough to know Sheila Pantry, she was another force of nature, and she was in charge of information at the Health and Safety Executive, the library as it was then. And she never retired. And she very recently died at a very ripe age, which I'm not going to reveal because she never told anybody her age. She was actually responsible for putting the first full text database on CD-ROM of health and safety information anywhere in the world, the first full text database of any kind. And it happened to be health and safety information. So when you're busy searching on the internet, you might not realize that actually the first data that was ever provided on CD-ROM was health and safety related. Is there anything else that you'd like to let people know, or anything else that you think really important for women considering entering the profession or already in the profession to know before I let you go?
We spoke about visibility, but I think that whole piece about reaching out, whatever media that works for you, to find people that are like-minded is fundamentally important. And don't let geographical boundaries put you off, you know, so reach out and get that network of people created around about you. You can work to and for each other. And I think that's the best piece of advice, because isolation within health and safety, being female, can be a challenge. I would call it your tribe. Find your tribe.
100%. Well, what a pleasure and a privilege to speak to you today. Thank you so much, Karen. Really, really appreciate it.
Thank you. Thanks for the opportunity.